Kwame, come quickly. What's wrong? I'm bleeding. It's not much, but I'm pregnant. Is my baby okay? Maybe it's nothing. Let's wait and see. No, I don't think bleeding during pregnancy is normal. Hello, Amma. Tell me what happened. I noticed bright red bleeding about 30 minutes ago. I don't have much pain, but I'm frightened. You did the right thing by coming immediately. Let me call Dr. Efua. Hello, Amma. I know you're worried, but we'll take good care of you. First, let me ask a few questions. Doctor, why am I bleeding? Is my baby in danger? Bleeding during pregnancy can happen for several reasons. Some are minor, but others can be serious. That's why every pregnant woman with bleeding should be examined by a healthcare professional. What could be causing it? In early pregnancy, bleeding may be due to a miscarriage, an ectopic pregnancy, or changes in the cervix. In the second half of pregnancy, we think about conditions like placenta previa, where the placenta covers the opening of the womb, or placental abruption, where the placenta separates too early. How do you know which one I have? We'll check your blood pressure and pulse, listen to your baby's heartbeat, perform an ultrasound, and do blood tests. If we suspect placenta previa, we avoid a vaginal examination until the ultrasound confirms the placenta's position. Amma, the ultrasound shows that your placenta is lying low over the cervix. This is called placenta previa, and it explains the painless bleeding. Will my baby survive? Most women with placenta previa deliver healthy babies when diagnosed early and managed properly. We'll admit you for observation, monitor you and your baby closely, and decide the safest time for delivery. I'm glad we didn't stay home. I almost ignored the bleeding because it wasn't heavy. That's an important lesson. Any bleeding during pregnancy should be taken seriously. Even a small amount can be a sign of a condition that needs urgent medical attention. If you're pregnant and notice vaginal bleeding, don't panic, but don't ignore it. Go to the nearest health facility immediately. Early treatment can save both mother and baby. Any bleeding during pregnancy is a sign that requires immediate attention. Symptoms range from light spotting to heavy flow throughout your journey. 1 in 4 women experience some bleeding during their first trimester. The first 13 weeks are a critical time for monitoring your health. Implantation occurs when the embryo nestles into the soft uterine wall. Bleeding can sometimes signal a more serious medical emergency ahead. An ectopic pregnancy is a condition that requires urgent medical care. As you move into the later stages, new risks can potentially emerge. Placenta previa happens when the placenta covers the opening of the womb. Severe pain may indicate the placenta is separating from the uterus. Issues with fetal blood vessels or preterm labor also cause bleeding. Recognizing emergency signs is vital for the safety of you and your baby. Seek help if you experience heavy bleeding that soaks a pad in an hour. Contact your doctor if your baby stops moving as much after 20 weeks. Doctors will check your vitals and do investigations to understand the cause of the bleeding. An ultrasound allows us to monitor the heart and the placenta location. Testing your blood helps identify anemia or the need for a transfusion. Physical exams must wait until an ultrasound confirms the diagnosis. Treatment ranges from simple rest to medication or emergency surgery. Always trust your instincts and call your healthcare provider for help. Bleeding in pregnancy is not a diagnosis, it's a symptom. Some causes are harmless, but others are life-threatening. Never ignore vaginal bleeding during pregnancy. Seek medical care immediately so the cause can be identified and treated promptly. Follow for more evidence-based pregnancy education and share this video. It could help save the life of a mother and her baby.